later disorders. So you got this point back.
Good morning, everyone. Good morning. How's everyone doing? Good? All right. So today we're going to be learning about calcium channel blockers. Do you know anything about this drug? Anyone? Yes.
From the name itself, I'm guessing it blocks the calcium channel in our body.
That's right. Calcium channel blockers is a class of cardiovascular drugs that are used to block calcium from entering the cells of the heart and blood vessel muscles. So if there's an increase in calcium, that means there's an increase in blood pressure. So inhibition of calcium channels lowers blood pressure. Does anyone know the mechanism of action of this drug? Yes.
So according to the textbook, it does reduce electrical conduction within the heart muscle.
That's right. It also decreases the force of contraction of the muscle cells and dilate arteries. Dilation of the arteries reduces blood pressure, which reduces the heart workload. So what are the uses of this drug? Hypertension.
Cardiac arrhythmia.
Angina.
So what are the contraindications for this drug? Does anyone know? Yes, Matt.
Heart block.
Heart block. What else? Heart failure? Calcium channel blockers also increases digoxin levels, the effects of beta blockers, and antihypertensive drugs. So there are two different classes of calcium channel blockers, dihydropyridine and non-dihydropyridine. We're mainly going to focus on two drugs that will be on your exam. So we have verapamil, which is non-dihydropyridine, and we have nifedipine, which is dihydropyridine. Non-dihydropyridine causes less vasodilation and more cardiac depression than dihydropyridine. They have negative effects at the SA and AV nodes and cause reductions in heart rate and contractility.
There are many factors that shape the dosage adjustment depending on how old the patient is, what medical problem they are trying to improve with the drug, if the patient is pregnant, has renal or liver problems, because the drug will be metabolized differently. The first drug that I will be talking about is nifedipine. The dosage for an adult for an oral immediate release is 10 milligrams 3 times a day. The maximum dosage is 180 milligrams per day or a single dose of 30 milligrams. For a sustained release capsule, it's 30 to 60 milligrams per day. However, the maximum is 90 milligrams per day. Hypertension dosage for an adult is an oral extended release 30 to 60 milligrams per day. Increase as needed. The maximum is 120 milligrams per day. When used to treat hypertension in a child or adolescent, you want to use an oral extended release tablet 0.25 milligrams per day to 0.5 milligrams per day. You do not want to exceed 3 milligrams per day. This can be also used to treat preterm labor and pregnant females orally, 30 milligrams loading, and then 10 to 20 milligrams every 4 to 6 hours. Nifedipine can be also used to prevent migraines. In adults, oral tablets are 30 to 180 milligrams per day. The next drug that we'll be talking about is verapamil. Verapamil can be used to treat angina in adults when taken orally, 80 to 120 milligrams 3 times a day. You will want to increase it weekly, but the maximum is 480 milligrams per day. Verapamil can be also used to treat irregular heartbeats in adults when taken orally, 240 to 480 milligrams per day in 3 to 4 divided dosage. It can be also used as an IV bolus, 5 to 10 milligrams over 2 minutes. When used in a child aged 1 to 15 years old, it can be used as an IV bolus, 0.1 to 0.3 milligrams at or greater than 2 minutes. You will want to repeat it in 30 minutes. However, the maximum you can give in a single dose is 5 milligrams. When used as an infant up to 1 year old, it's given as an IV bolus 0.1 milligram to 0.2 milligram over 2 minutes, and you would repeat this after 30 minutes. Verapamil can be also used to treat hypertension in adults when given orally 80 milligrams 3 times a day. For patients who have a hepatic disease or a geriatric patient or a compromised ventricular function, the adult patient will take it orally 40 milligrams 3 times a day initially and then increase as tolerated.
Oh, Professor. Yes, Lena.
So my dad is actually on calcium channel blockers because he was recently admitted to the hospital for hypertension and angina.
I wonder what medications the doctor will prescribe me for my chest pain and for my high blood pressure.
Don't worry, Dad. The doctor and nurse will come in soon to talk to you about
Come in.
Hello. How are you doing today?
I'm fine.
Okay. So before we give you this medication, I'm going to monitor your blood pressure, your heart rate, and your respiratory rate for any changes in hypertension, bradycardia, and respiratory depression, which are the side effects of this medication. Okay, so don't stop taking your medication suddenly because it could lead to an MI or other dysrhythmias. So you should also monitor your input and output, and don't forget to report any swelling. After taking this medication, you should also evaluate its effectiveness in reducing your blood pressure, your chest pain, and improving your activity tolerance. So your potassium level alongside your liver and kidney function should be monitored regularly to prevent any toxicity. So any questions for me?
No, I don't.
Okay, so a different nurse will come check up on you in about half an hour. Okay?
Okay.
Hi, Mr. Gold. How are you?
Yeah, I'm fine.
Okay. My name is Edith and I'll be your nurse. I want to educate you on the side effects of the medication as well as what to watch out for and call us immediately if you see them. You will be going home with either verapamil or nifedipine, and if you receive the enteric coating, I want you to take it as a whole. Do not chew it or crush it up, because doing so will release the entire medication at a go, and we don't want that. You want it to be released over time.
Does my father need to take the medication on food?
Yes, the medication can be taken with or without food. However, I want him to drink plenty of fluid and increase his fiber as well, because we don't want him to be constipated. Also, if he loves grapefruit, he might want to reduce that, because too much grapefruit will cause the medication to accumulate to toxicity levels, and we don't want that to happen.
Did you hear that, Dad?
I don't know what she said.
Okay, one more thing. Please make sure you take your blood pressure at home and record it daily. If you see any changes, please let us know. If you experience any swelling in your arms and feet, call us right away. If you have shortness of breath, difficulty breathing, or slow heartbeat, let us know. And if you gain weight and you cannot explain why you've gained weight, just call us as well. Okay, Mr. Gold, do you have any questions or anything?
No, I don't.
Do you want me to clarify anything before I go?
No, I just want to go home.
Okay, I'm glad to see you out of here. Feel better.
Thank you.
So class, who can tell me how calcium channel blockers are absorbed and distributed?
Hi, Professor.
Hi,
Is this
Taylor.
a good time?
Yes, this is actually perfect timing. Class, this is Taylor, your TA. Say hi.
Hi, guys.
So, Taylor, can you explain to the class about pharmacokinetics of calcium channel blockers?
Sure. Calcium channel blockers can be taken orally and intravenously. They are then rapidly absorbed by the GI tract, even though the first pass effect reduces its bioavailability. After that, it's distributed mainly among proteins and also poorly in the central nervous system. Does anyone know how calcium channel blockers are metabolized?
From the textbook, it said that CCBs are metabolized by cytochrome P450.
Because of the first pass effect, you can use a combination of calcium channel blockers and cytochrome P450 inhibitors to increase the effectiveness of the drug.
Now, can anyone tell me how calcium channel blockers are excreted? Yeah.
So calcium channel blockers are excreted like many other drugs through the kidneys and eventually in your urine. Rapamil has a half-life around 4 to 12 hours.
Great job, guys. I can tell you guys did your readings.
Thank you, Taylor. Do you want to join the class?
Yeah,
Okay, great. Thank you again for sharing, Lehne. So class, I hope you all learned something about calcium channel blockers, and remember that your exam is in 2 weeks, so study every day. Class is missed. If you have any questions, feel free to ask me. Dilation of the arteries reduces blood pressure, which reduces the heart. Oh, wait, no, sorry. That's right.
Ready.
Angina.
Wait, do it again.
Did you hear that, Dad?
I don't know what she said.
Sorry. Wait, start over. Like a bigger signal.
So according to the textbook, it does reduce.
And wow, Mac, thank you for not listening to this. I feel disrespected. Get out of my room.
You just focus.
Oh my god.
I don't want to have any.
Get out of my bed.
So, can you tell them how calcium channel blockers are restored?
Either going to be enteric or Lehne.
Even though the first pass effect reduces bioavailability, bioavailability.